The doctors in a hospital in Chennai that he had this sort of outgrowth, on the upper right kidney, basically, pretty much. They were like, this could be cancerous, this could be benign, and all that. It was quite vague and confusing at the time. My dad, his name is Shankar R. He's around 57, 58 years old. We are actually from Chennai. The reason we came to any hospitals was to get his radical nephrectomy done. So they have removed the complete right kidney. Before, he used to have like 3 or 4 months before, he's been having like swelling in his feet. That was pretty much the only remote symptom that we saw. But other than that, there was no pain, nothing. It was quite asymptomatic. We had actually gone for a regular master checkup, once in 6 months, that sort of thing. And while doing that, the doctors in a hospital in Chennai, they had found out that he had this sort of outgrowth, on the upper right kidney, basically, pretty much. And they were like, this could be cancerous, this could be benign, and all that. It was quite vague and confusing at the time. So due to that, we were like, okay, this is suspicious. This is something I think we should explore. Then eventually they did the CT scan, the MRI, blah, 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 the whole thing. And finally we found out, okay, this is covering pretty much, like if the kidney is about 10 centimeter, this is covering roughly 7.5 centimeter of the kidney. Because it was, as he said again, it was intending towards the liver, touching it, but not infiltrating it completely. So they didn't want to take any risk. And eventually they've scraped a little bit of the surface of the liver and they've sent it to for their biopsy as well, the renal biopsy, which we are awaiting the results for. Then we wanted to get a second or third opinion from other hospitals. Then eventually we came to Bangalore, to any hospitals right here, for a urology kidney hospital. I think for this issue, I think this would be an appropriate fit for the surgery. Yeah, there's a doctor named Dr. Shankar, and he had referred, okay, you can go to this hospital, it would be appropriate to do the surgery. It was laparoscopic. The surgery was pretty successful, and now is in the stage of the post-operation recovery. And so far, there's been a bit of pain, as with any common surgery. It's pretty common. And everything was kind of smooth, no big hiccups. And the doctors, the team of doctors that operated on my father was Dr. Nagarjuna Reddy, one, then Dr. Krishna Prasad. We had sought consultation with Dr. Padmanabhan as well. We would like to thank them for performing the surgery quite successfully and handling everything safely and smoothly, without like any major crises in the middle. Every 1 or 2 hours, people were coming in, whether it's checking the BP or the sugars, just taking care of everything, just checking if everything's fine. So yeah, overall the service was good, I would say, especially with subordinate staff, with nurses, the people who even clean the rooms and all, don't want to leave anyone out. So yeah, it was pretty much good. Yeah, overall experience was pretty good.